Hitasukena hidalokika palalokikayam mapanisa panigariga saripaga marisani sada pamariga mapadani rasti.
Hello, everyone. Welcome. Thank you for joining us. My name is Jisha Menon, and I'm the Faculty Director of the Center for South Asia at Stanford. We're pleased to be able to bring you our special event today, Understanding India's COVID Surge with Professor S.V. Mahadevan. Before we get started, I'm going to go through our land acknowledgement. We acknowledge that Stanford sits on the ancestral and unceded land of the Muwekma Ohlone tribe. This land was and continues to be of great importance to the Ohlone people. Consistent with our values of community and diversity, we have a responsibility to honor and make visible the university's relationship to Indigenous peoples. Welcome, everyone. These have been really distressing times for people in South Asia. The news coming out from the region is really concerning. And if you have family in the region like I do, then we're all in this together in our concern and our anguish for our friends and family in the region. As you know, India has reported nearly 18 million cases and over 200,000 deaths. Epidemiologists say that the true number of deaths is 2 to 5 times greater than what's being reported. India recorded 360,000 cases today and nearly 3,300 deaths, another new daily global record. Less than 10% of Indians have gotten even one dose. A few days ago, positivity rate hit 36%, which means 1 out of 3 people were infected. This situation is rapidly deteriorating. Hospitals are full, oxygen has run out, the sick are gasping for air, people are dying while they wait in line to see the doctors. And you've seen the images beaming out from the news, the smoking fires from cremation grounds, etc. It's a really, really distressing scene to view. My own parents in Bangalore have had their first dose of AstraZeneca and are too worried to even step out to get their second dose because the scene outside is so chaotic. I was talking to my sister earlier who said that people are no longer waiting for ventilators or hospital beds, they're really waiting for cremation sites. So it's a really, really dire situation. And these accounts from friends and family have really shaken us all. To help us make sense of what's going on, we're really pleased to have our colleague in Stanford Emergency Medicine, Professor Mahadevan. Thanks so much for joining us at such short notice to throw some light on the situation. Professor Mahadevan has just recently returned from India and has seen firsthand some of what's going on the ground. Thanks also to Lalita Duparon and Simrat Mathur for putting this together at such short notice. A quick housekeeping note, please put your questions into the Q&A box and we'll try to get to as many questions as we can. Let me briefly introduce Dr. Mahadevan, who is a professor of emergency medicine at Stanford University Medical Center. He is the director of South Asia Outreach at the Center for Asian Health Research and Education, the director of Global Affairs and Strategy at the Stanford University School of Medicine, and a founding chair of the Emergency Medicine at Stanford University. His research and work have taken him to Myanmar, Cambodia, Uganda, Nepal, China, Egypt, Pakistan, and of course, India. He has published widely on issues in India, such as education for healthcare providers, respiratory illness in children, traumatic injury, and survivor support, to name a few. We're so grateful that he was able to make time for us today to speak on what's unfolding in the country. Thank you so much. Over to you, Maha.
Thank you, Jisha, so much. And thank all of you for making time for me today. And I particularly want to thank the Center for South Asia for creating this opportunity to share my experiences and also talk about what is going on in India. Crazy as it might sound, I just returned from India 1.5 weeks ago, just as the crisis was beginning to unfold and get worse. I was there visiting friends, family, and one of my favorite places, the forests of Karnataka. And I booked my flight in February of 2021 after I had been vaccinated. And as I sort of saw that the number of infections in India were trending down, they've been decreasing with daily cases down 90% from the peak in the first wave from last year. And as Jisha had mentioned, cases have been rising over the past 10 days, over 350,000 new cases, but that probably underestimates the true number of cases. It could be as high as 10 times that number. Hospitals are full, as you can see on the news. They're running out of basic medical supplies and that life-saving oxygen. They're even running out of testing kits to test for COVID. And unfortunately, as bad as things are right now, they're probably only going to get worse. And we're probably 2 to 3 weeks away from the peak or the worst of this. And that's typically when the severe complications of someone who's gotten a COVID infection typically arise. So it begs the question, I mean, how could this happen? Everything was going so well. How did this happen? And I'm going to share, my thoughts and opinions. I'm making educated guesses about what may be happening. Maybe 6 months from now or years from now, we'll have the real story. But, I've been thinking about this obviously a lot. It affects my friends, my family, my colleagues around the world, and particularly in India. And the first sort of thing that I think happened is we let our guard down. And that's understandable. The first wave of the virus had passed last year and cases were declining. In India, there was so much, positivity about this trend that the health minister, in fact, declared in early March that they were in the end game of the pandemic. And to add to the good news, vaccinations had started in India. India was manufacturing vaccines, not only for India, but for the rest of the world. And I heard it over and over again from family and friends. There was a sense of pride about Indians, that they were tougher, that they had survived so many infectious diseases over the years. And the fact was that their population, if you look at the proportion of younger people in the population, they were a younger population. And we know that COVID is worse the older you are. And there's a feeling that, hey, we're not susceptible to COVID like other people in other parts of the world. And they could have made a case for that in December and January, the way things were progressing. But the initial virus, this virus that passed around the globe, part of India's first wave, in my estimation, it probably wasn't as infectious as the current variants that are circulating not only in India, but in other countries and in the US as well, and are currently obviously spreading across India. As I mentioned, the first iteration of this virus that got out didn't cause severe illness across the age spectrum. It primarily affected elderly patients and those with comorbid medical conditions like diabetes or hypertension or immune compromise. The current virus that is going across India is now affecting not only elderly patients and those with comorbid conditions, but younger adults and children as well. Also, if you had COVID during the first wave, there's a sense of I've already had it, so I can't get it again. But the fact of the matter is, as we're learning, having the illness once and developing natural immunity to the illness may not guarantee that you are immune from getting it again. That this notion of herd immunity, that if enough people get the virus naturally and they have antibodies to the virus, that would protect everyone from getting the virus in the future. This notion of herd immunity probably can never be achieved by just getting the infections. And I think we're learning that as wave after wave affects countries across the world, including India. So, 2020 we thought was going to be the lost year, not 2021, but it may not be the case. So what else happened in India? There was probably a sense, amongst everyone that the worst was over. And you can see that not only from what government officials were stating, but the way people were feeling. And you know, what you started to see were people in India now engaging what I would call high-risk behaviors. What are those things? Those things are like attending political rallies where you might be shoulder to shoulder with other individuals, one who might have COVID and then spread it to the rest of the people. It's a time of religious festivals like the Kumbh Mela, which is attracting people from across the country who attend the festival and then return home. January through March is a very popular time in India for weddings, and people have been waiting for a year to get married, to celebrate. They were thinking 2021 was going to be that opportunity. So weddings, mass gatherings of individuals from all over the country getting together to celebrate someone's wedding, also happening. And if you had COVID, and I know that some of my relatives did, they were starting to go to restaurants, gatherings with friends and families, thinking the worst was past them. And all of this is through no fault of theirs. This is normal pre-pandemic life. This is what we were hoping to get back to. And I think there was a collective sense that, hey, the worst was over and it was time to get back and start engaging in what life was like before the pandemic began. But in my mind, sort of the problem was that the variants of this virus had arrived in India or were forming in India. And as we're learning, these variants are more infectious and can spread more easily from person to person. And now due to these gatherings of people and travel, people were not only getting infected with the virus, but they were bringing the virus back to their own communities. And what about this particular virus? It's unique in so many ways. Obviously, it's dominated our lives for the past year and will probably do so for the next year. What makes it so challenging as opposed to other viruses that we've come in contact with over the past 20 years? Well, the problem is this. The person who gave it to you can look entirely normal. They can spread the virus for days before they actually develop any symptoms, if they ever develop any symptoms. And we know that it's hard to mask all the time. We are guilty, all of us, of letting our guard down. It's hard to mask at home in the presence of your loved ones. It's hard to mask at a dinner table where somebody might be 3 feet away, but it's not far enough, and it's a prolonged period of spending time in someone else's airspace. So if one single family member comes in contact with someone who is sick, now because these new variants are so infectious, they can spread it to other members of the family, and they do so silently, generally, because they're not exhibiting any symptoms. The other problem is you don't get sick right away and you don't develop the complications right away. So there's a delay. There's a delay between getting the illness and recognizing that there's a problem. And I think that's what you're seeing right now in India is no one really could anticipate the complexity and the gravity of the situation because just 3 weeks ago, things didn't look so bad. But that's what happens with COVID. The terrible complications and especially deaths usually don't occur for weeks after you get the infection. So by the time everyone had figured out there was a problem, the magnitude of the problem had ended up being beyond anyone's wildest imagination. And I can tell you honestly, everyone was caught off guard. And as you can see in the news and you're hearing here, we're dealing with a humanitarian crisis right now on a massive scale. And it's not just in one part of India or a specific segment, it's in every corner of India. And it's affecting all the major metropolitan areas. We can contrast that with the Bay Area where most of us are right now. We've had a very successful vaccination campaign. I believe as of today, 35% of individuals in the Bay Area are fully vaccinated. We've had incredible adherence to safety measures such as masking, hand washing, social distancing. And I think now, as a result of these two things, we're reaping the benefits. We have fewer COVID positive patients in the hospital and the emergency department. We have definitely fewer COVID positive patients that are requiring critical care. And here, there's some semblance of life returning to normal. My younger brother just went to a Warriors game, for the first time in a year. So it's like things are kind of returning to normal here in the Bay Area. So the question really is, maybe things are fine or getting better here, but things are out of control in India. So what can we do to help those individuals that are suffering in India right now? And it's a really difficult question that I get posed regularly, especially this past week. And it's hard to answer. Right now, as Jisha mentioned, there are not enough resources to match the demand. There are not enough hospital beds. There's not enough oxygen. There's not enough ventilators. There's not enough medications to take care of the patients that need them. And the current strategy in the country is locking down major metropolitan areas like Bangalore and Delhi and Mumbai. They're all under lockdown. Trying to increase bed capacity, and that is done through building dedicated COVID hospitals, doing creative things like taking over hotels and turning them into COVID-like hospitals, diverting oxygen supplies from the industries to hospitals. I believe hospitals were only using 10% of what India produced. Most of it was going to industries. So that shift is already occurring, trying to increase oxygen production. And what are we as a nation, what is the US doing? What is the Biden administration doing? Sending ventilators, personal protective equipment, diagnostic kits, the raw materials you need for vaccines, and medications. And those are all good things. And I think the rest of the world is certainly trying to pitch in. You may feel helpless. It's really easy to feel helpless when we're so far away and our friends and family need us and they're suffering. So what can we tell them? What can you tell them that will help in this situation? And I'm going to share some things that I talk about regularly that you can share with them. And a lot of it's common sense, but I wanted to share it again. The first thing is, look, if you don't have a reason to be outside, please stay at home. That's the most important thing you can do. The only way to contract this illness is to come in contact with others. If you have the liberty of staying at home, stay at home. Avoid mingling with anyone outside your immediate family. When you're outside your home, wear a mask. If you're using a cloth mask, and I saw a lot of cloth masks in India, wash it frequently. It's not something that you can just use the same mask every day. When you're using the mask, it's trapping the COVID viral particles in the mask. So it gets contaminated over time. So after using it for a day, wash it, have another mask ready. Once it dries out, you can start using that one again. Wear it properly. I saw this over and over again. People pulling their masks down to talk and then putting them back up, letting it reside under their nose, under their chin. It can't do its job. It can't do its really life-saving job unless it's worn properly. If someone has to come and visit you in your home, wear a mask and ask them to do the same, or have a mask available that they can wear. This is going to protect both you and them. Some other things you can do there: air out your living space after someone has visited. Take a fan, put it in the window, direct air from outside, inside, and start sort of diluting the air in your environment and pushing it out and replacing it with air from outside. Know what high-risk situations are, and those are as follows. Anytime you're indoors with poor air circulation, that is a high-risk situation. Remember, the virus is invisible. It's in the air. It's in the air that people are breathing out. And if you are there and you're sitting and you're not moving and people are talking and they're unmasked and you're unmasked, you're going to breathe in that air. So indoor spaces are a hazard, and you have to be aware of that. Places where people are close together and talking loudly. We know that coughing and sneezing pushes the virus out, and people have gotten really good about covering their nose and mouth when they cough or sneeze. But singing, laughing, talking gregariously, all the things that we love to do also push the virus out into the environment and beyond the immediate space that we live in, out towards other people that may be far away from us. So you want to avoid places that are like that. Avoid other places that have poor ventilation. Bathrooms, for one. If you're going into a public bathroom or you have to use a bathroom, make sure you're masked when you go in there. Wash your hands frequently, or if you can't get access to soap and water, use alcohol hand gel. Remember, you're touching things all the time, and then touching your face. That's a way of contracting the illness. So be really good hand hygiene is imperative. If you develop symptoms, and I know it's hard, you have to isolate yourself to protect your friends and family and others. You need to get out of the streets and into your house or your apartment and stay isolated. Check your vital signs. This is a good time to invest in a way to take your temperature, your blood pressure, and your oxygen saturation, which oftentimes can be difficult to know. You might feel all right, you might look all right, but your saturation, which measures the level of your red blood cells that are saturated with oxygen, may be abnormal. And so one sort of easy way to measure that is small devices like this. This is a clip-on pulse oximeter, less than $20, available, can be kept at your home and used in addition to a thermometer and a blood pressure cuff to monitor vital signs and just make sure. It's also important if somebody has COVID and if their oxygen saturation is dropping, it's an indication that they're getting sicker and that they may need oxygen and further therapy. And so being able to pick that up earlier rather than when someone becomes really sick is imperative. And so having that pulse oximeter can really be valuable. Other things you can tell your friends and family and loved ones. Encourage them to get vaccinated if they can. Remember, vaccines don't provide immunity immediately. It's going to take weeks, but vaccines are what right now is blunting the spread of the virus here in the US and saving lives, no doubt about it. Current studies suggest that the immunity from vaccines can last as long as 6 months, and as we do more studies and look further out, it may be longer. One important thing that I think we've learned is the immunity that you get from a vaccine is definitely better than the immunity you get from having an infection. It certainly probably lasts longer and I believe is more robust by virtue of the fact that we get one vaccine to prime our immune system and a second to really get it going. Vaccines don't prevent 100% of infections. What do they do then? They prevent the serious complications of COVID. And those two things are being hospitalized and dying. And I'll just share one extraordinary statistic that really highlights this. Of the 75 million people immunized in the United States, 75 million people, only 75 have died, or 74. That's 1 in a million vaccinated people has died from COVID. That tells you how effective our vaccination strategy has been. Vaccines are the only way that the pandemic will end. And this may be my opinion, but I firmly believe it. We can see this now in India. It's doubtful that we will ever reach herd immunity from natural infections alone. I know that herd immunity strategy was put out there last year, and I'll be honest with you, we didn't have enough data. We didn't know. It sounded like potentially it could have worked. We know in one small Amazonian area of Brazil where the infection ravaged a community, Manaus. And it's thought that it's anywhere from 60 to 90% of people in that community had got COVID and either died or survived COVID and thought that that was the worst of it. Well, just 8 months later, it came back again in the form of a variant and ravaged that town where up to 90% of people had developed or had the infection, and just shows you either the variants aren't affected by your old antibodies or your old antibodies from that infection 8 months ago have waned, have gone away, and are no longer protecting you. There are 2 vaccines in India, Covishield, which is the AstraZeneca vaccine, and Covaxin, a vaccine developed in India. Get the one that you can, or let your friends and family know they should get the one they can. And then sort of, why this is important to us here, to everyone around the world. Even though things are better where we are locally, what happens around the world is really important to us. And not only for the ethical and humanitarian reasons that we would expect, and that we need to be, cognizant of. It's also because when we allow the virus to spread and mutate into potentially more infectious and lethal forms, this is dire not only for the country where it's happening, but for the entire world and for us here as well. And I just want to read a great quote. We in emergency medicine, we talk about the chain of survival is only as strong as the weakest link. And in the same way, the global struggle against COVID, the chain of humanity is only as strong as its weakest link. And that weak link right now is in India. Thank you very much. I'd be happy to entertain any questions that you might have at this time.
Thank you so much. We have many, many expressions of appreciation in the Q&A as well. So please, audience member, if you have a question, put it in the Q&A box at the bottom of the screen. And I'm just going to weave some of the questions together, because obviously some of the questions are on similar topics. If you don't hear your exact question being answered, it's not that we are not ignoring it. I'm just kind of bunching them together. And I think the first one we want to talk about, Dr. Mahadevan, is the variants. And you already discussed that a little bit, but I think people are very concerned that the vaccines are not going to be a good strategy against the new variants, both in India as well as here. So can you speak a little bit to that?
Yeah, I would love to say, look, the vaccines are going to work against the variants, but it's something that we're going to learn over the course of the upcoming year. And we may not even have seen all the variants yet. We do know that the variants are here in the US for sure. But as we have continued to vaccinate our population, we're seeing the numbers go down. So I'm going to keep my fingers crossed and hope that that trend continues and that we don't see another surge in vaccinated individuals as a result of the variants. It's that reason that we don't want to let our guard down here either. And what I mean by that is, I know the CDC just released guidelines saying that you don't have to wear your masks outdoors. And I agree wholeheartedly. I stopped wearing my mask outdoors a while back because I knew that was the case. But if you're going to a grocery store, if you're visiting somebody who's unvaccinated, if you're, in higher risk situations, as I had alluded to, let's continue to wear our masks until we know for certain it's working. And look, I, for one, want to get back to being able to see everyone's lovely face just as much as anyone else. But I also realize you can see by what's happening in India how easily we can slip back into a situation where we're suffering again. And so rather than have that happen, I think it's prudent, even if you're vaccinated, to continue to be careful. Now, if you're visiting a neighbor who's also been vaccinated, I know there's a suggestion that, that's okay. And look, it's all about risk. Yeah, you probably are okay. But remember, as I mentioned before, no vaccine is 100% effective in preventing the infection. And we know that already. What it really does, and what's most important is, it prevents you from going to the hospital and having to be admitted and dying. And that's so much more important.
Thank you. Can you speak a little bit about the fact that the vaccines that are in India are different from the vaccines that are here? And so are they more effective in India or less effective because maybe they're created faster and at a greater amount? Also the issue of now having to go out to get a vaccine. What if you get sick from your vaccine? You can't go to the hospital because that's very dangerous. So how do people make these kinds of decisions? And finally, I'll weave this in as well. Question is, what happened to the surplus of vaccines in India? There was a surplus and now there aren't enough. So what's happening there? Thank you.
Yeah. And if I forget to answer a question,
I'm sorry, it's a lot.
I'm getting old and my memory is not as good as it used to be. There are two vaccines, as I mentioned, in India, and one of them, it has a different name, but it's the AstraZeneca vaccine that's been in the news of late for the very, very rare complication of hypercoagulability and blood clots. Just here are the figures on that particular vaccine, published in March. 76% efficacy against symptomatic COVID-19, 100% efficacy against severe or critical illness and hospitalization. and 85% efficacy against symptomatic COVID in people that are over the age of 65 years. So, these vaccines, I believe, will work. It's just when only 10% of the population has been vaccinated, it's hard to reap the benefits. When the vast majority of the population is not vaccinated, you're not going to see the effect of the vaccine in blunting the spread of COVID. There was a question about, look, I have to go out of my house to get the vaccine. Should I stay? I would say, look, if you have the opportunity to get your second dose, go and do it. Just be careful and adhere to the precautions I had mentioned. Wear your mask. Try and stay as far away from others as you can. Think about enclosed spaces. I'm going to give you one that's very common. In India, it's very common to have someone drive you as opposed to driving yourself. Think about that person. Are they wearing a mask? Think about that environment. Are you in an enclosed space? Yes, you are. So could you open the windows and increase ventilation? Could you both be masked? Could you wear a face shield or something else to even reduce your risk further? Those are all the things that you might consider doing. I think it's really important to get that vaccine, to get that second dose, because most of the studies are basing their data on a complete vaccination as opposed to a partial vaccination. Was that another question? Oh, are they made as well? Look, the Serum Institute and other institutes, I haven't visited and seen them firsthand, but I gotta believe that they are doing everything in their power to do the right thing and produce the vaccines in a safe and ethical manner, because they're doing it not only for their citizens, but India is going to be producing the vaccines for the rest of the world. Why did things go bad? I just think, the infections were trending down and you just feel like you have more time. The urgency wasn't there. Hey, look, we decreased 90% from where we were at our peak. So yes, we need to get vaccinated, but there's no rush because we're doing better. And we have vaccines that we can share with the rest of the world. And then what happens is what's happening now, which is you realize that vaccines are the only way to end the pandemic. And we just don't have enough for everyone in the world. And we're seeing that firsthand in India.
Thank you. Thank you so much. Again, many appreciation and expressions of thanks in the Q&A. Thank you for those. And I'm just going to ask Simrat to put in the chat a list that we compiled. And I just want to make a very clear disclaimer. Dr. Mahadevan and some other people sent us lists of organizations that are working on the ground in India. So we compiled a list for you. It's also on our website, southasia.stanford.edu. These are not places that we have vetted. We're not endorsing them officially. It's just a list for you to start with, because we all want to do something and we don't know what to do. And sometimes we get stuck in that. So just a place for you to go and start clicking, and whatever feels good to you, that's the path that we recommend you follow. And thank you very much, Dr. Mahadevan, also for sending us the list and getting us started with that. So that is in the chat right now. So some questions around the government, and I think that we can't speak to that too much because we don't know, but maybe you can say a little bit about the official numbers, whether they're being forcefully changed or not, as perhaps not something we can speak to, but what is your sense of what's being reported? Perhaps you can speak to that.
Yeah, I think it's really challenging to keep track of the numbers. There's so much chaos. There's so many people in hospitals, but I don't think we really need, what difference does it really make? We can see what's happening. We can see the impact. We can see all the funeral pyres burning in the cities and the devastation. We know the impact. So whether it's half or a third, does it really matter? We know that, COVID is taking its impact on the citizens of move forward and learn from what's happening right now, take care of the people that need our help in the moment, and also think about how we can prevent a third or fourth wave from happening, having learned now that this is a very, very challenging virus, something that we've never encountered in our lifetimes. And we are continually learning how it impacts different populations and different people in different countries. And so this is just another lesson for us.
Yeah, indeed. We have quite a few questions around travel, some of which I imagine that I know what you're going to say. Is it okay for us to travel to India? You just did. Is it okay for our family to come and visit us from India? And assuming that this variant is going to make it over to the Bay Area, are our vaccines efficient, effective? I think you already answered that. What can we do to keep ourselves safe? So 3 questions. They're traveling to, traveling from, and how do we deal with the variants coming our way?
Yeah, I don't think we have enough information to really speak to. Look, when I was there, I'm a physician. I know how to keep myself safe when I'm caring for someone who's got COVID in a very small, 10 by 10 patient room. And so I felt very comfortable that I would apply the same procedures. I can wear a mask for 24 hours and not be bothered by it because that's part of the way, that's my profession. But I don't think that most people are going to be comfortable doing that. And more importantly, I don't think I can confidently say at this point that even though you've been vaccinated, that you're not going to get sick with, it's the hope, it's the assumption, it's the hope, it's what we're hoping for, but that you're not going to get sick with a new variant that's appeared in another country. So I would say, I made my decision as a personal decision. It was personal travel based on what was happening back in February, early February, late January. But if I had to make the same decision again today, I wouldn't travel personally, just because of what's happening there. And there's so many other reasons. When a country's impacted like India is right now, it's shut down. It's not a place that you want to go to. There's curfews, there's lockdowns. It's just not the place that you want to go to in this very moment. And in terms of traveling from India to here, I know a lot of countries have shuttered their borders for concern of spread of variants. It's one of those things where you want to do everything in your power to make it as safe as possible. So that would mean self-isolating weeks before the travel, really doing that, getting a negative COVID test before you travel, being careful on the plane, and then isolating again here once you arrive to, one, prevent yourself from getting the infection, but more importantly, prevent spreading it to somebody else. If somebody did have to come, that would be the advice that I would give them.
Would a PCR test detect the Indian variants?
A PCR test would detect the presence of COVID, but keep in mind, some tests you get what we call a false negative. That is, you have COVID, but the test is negative, and that's going to happen. There's no way around that. And that can happen because the sample was inadequately collected, or it's so early that you really haven't, you're infected, but you're not producing the virus in the quantities that are required to be detected on such tests. And that's going to happen. And that's why countries like Australia require you mandatorily to basically be quarantined on arrival in a hotel of their choosing and tested, because they know even though you're negative when you depart, you may end up being positive when you arrive.
Yeah, okay, thank you so much. I like this question because it's really about pastoral care, and I'm going to weave in another question about mental health in this one as well. So the first question is, some of our international students and staff for that matter are worried about COVID positive family back home. They want to go back, they can't. How can we help them manage the stress of the situation? And then the second part of that question, a little bit different, is can you speak to the mental health effect of long-term isolation as we're looking towards more lockdown? How do we manage the stress of that?
Yeah, two tough questions. The thing about wanting to go back and help, maybe the best thing that you can do rather than rushing back is to share some of the things that we talked about today about safety, and sort of, the myths of COVID and how you get it and how it impacts people. I think, sharing those things about how to take care of yourself, how to wear a mask, wash your hands, avoid other people, though that's not common knowledge. It certainly wasn't a common practice when I was there. In one setting, I was in the forest for a couple of days. getting dinner at a buffet line, and I would get my food with my mask on. I would walk far away from everyone else and sit by myself to eat, whereas everyone else was sitting at sort of picnic tables, laughing and giggling, what you would normally do. And I realized that that was a very dangerous place for me to be. And so, and it's not that anybody wants to harm someone else. That's the truth of the matter. It's just that they don't know. They don't know that's a high risk situation. And so being able to share that with others and make them aware of, hey, here's how you get it. Keep in mind, the people that are giving it to you are asymptomatic. Be careful. Those are important lessons I think we can share with others that we have learned, sometimes the hard way, in terms of, that you can get it again, that you're not super immune if you've had it once. Those are the kinds of things I think we need to share with people there. And that will give us some comfort because we're sharing good advice. And if the advice is heeded, it definitely will help decrease the spread of the virus in the country. With regards to mental health, a very, very tough question. It's impacted everybody at some level, physicians especially, as we've dealt with the droves of really sick people that we're not used to seeing, people die in the way that they have, young people especially, those where there's very little you can do. It's been tough, and it's been tough on everybody who's been doing the right thing, staying at home, isolating. Just some things. This is not based in science. I'm just going to share, what we have done is sort of getting back to sort of more simple things, local things, spending time outside, spending time exercising, walking, appreciating your neighborhood, gardening, growing some tomatoes, get a pet. These are all things that we've done. We never had a pet. All the time we've been here, we've gotten a pet. I think those are things. My cousin set up a group Zoom meeting for all of our family. And it's been fantastic to catch up with people and see everyone. Those are things that we can potentially do. One thing I didn't talk about, and maybe I'll just address it here, which is, when is this going to end? We thought 2020 was the bad year, and this is going to be our year, and 2021 is going to be great. It's not going to end until the world has been vaccinated, in my mind. And that could be at the current rate of vaccine production, it's going to be years from now. So as we think about what we collectively can do in the moment in terms of sharing money and supplies with India, and later vaccinating people, we really have to think about, if the end game is to return to our normal lives, we need to put the rest of the world on our radar and really ramp up vaccine production and make it available to every single person, because that's the only way we're going to get back to I really believe, I was hopeful too in January, hey, things are better, and they will be better for sure. But the only way to really get back the world back to normal is to vaccinate everyone.
So we have quite a lot of questions, and I know you answered some of these, but I think perhaps you can speak to them more specifically, because you spoke so eloquently just now about how we can talk to our families in India, about just some of the practical things. And I think sometimes, we all have different channels of information, and we think that, well, we know other people know, and that's not necessarily the case, even within our own circle. And so my family in the Netherlands, they have different information streams than I do, and we compare notes. And so this would be true between the United States and India as well. A lot of concerns about the vaccine. So I hear you say, just get vaccinated. It doesn't matter what vaccine, just do it. It's the only way. But people are worried. They're going to get side effects. They just don't know how safe these vaccines are. They're worried about the long-term effects. So can you give us some really practical tools, how we speak to our families in other countries, in particular in India, and tell them, yes, but you need to go and get vaccinated? And do people really, should they be going for their second doses now in this moment?
Yeah, with regards to the vaccine, look, we as physicians, have collectively agreed to be vaccinated. And we've looked at the data, we've looked at the science, we've looked at the studies, and we realize that it's probably this vaccination has probably been looked at more than any other vaccine in the history of mankind, obviously. And what we're seeing is what I'm sharing. There's a lot of fear about vaccines, and hopefully sharing more information will undo that fear. But the fact of the matter is, if you've ever cared or watched somebody suffer with severe COVID, you realize that we're not dealing with something that is like a common cold. It's a really devastating illness that can claim people from all walks of life and from all ages, all ethnic groups. And so if you think about your true risks from vaccination versus your true risk from either getting COVID or transmitting it to your loved one who's really susceptible to COVID, there's no reason not to get a vaccination. And I think we have enough data now that shows it is safe. There may be some very rare side effects, but they are rare, truly rare, rarer than the number of deaths, the scenes that you can see playing out in India right now. So educate yourself, I would say, go and get the information, but get it from credible sources and talk to people that have been vaccinated and understand why, rather than an aunt or an uncle who heard something here or there, or you read something on Facebook. This is not something we're trying to push on people because for any other reason than we have their best interest in mind and we have the rest of the world's best interest in mind. And so the only way out of this pandemic is through vaccination.
Thank you. That is very clear. And I think there's some helpful tools in that, things that we can share with our families to help them understand why this is so important. So thank you. Can you speak a little bit? I'm very curious about this too myself, so I'm glad this came up in the Q&A, about remdesivir. I think it became famous when famous people were getting it, but I heard it's also being used in India. And is it effective? Should it be more widely available? What's happening with that?
Yeah, this is a really tough question. I'm going to try and address it as best I can. It's not an easy question just to knock off in a couple minutes.
Okay, fair enough.
With regards to COVID, there's no silver bullet. There's no magic cure. So anyone that says, "Hey, if I get this or this, I will be fine," there's nothing that's been studied to this point that is a surefire cure or preventive strategy for COVID, except for vaccinations, right? I mean, if there's really something that can be impactful, it's vaccinations. Now, there are different kinds of medications, including remdesivir, that can be used, but they have very specific indications. And so, it only works in a subset of the population. The degree to which it works has been questioned. Some people say to a small degree. Some people question whether the true impact. What ends up happening is that it somehow has acquired this magical quality where people think, if I don't get remdesivir, and I have nothing against the drug whatsoever, I'm just saying that I can't be cured. And I just wanted to dispel that myth. It's not the truth. There are other medications that are widely available and very inexpensive, like dexamethasone, which we also know is very effective in certain subsets of patients that are sick with COVID. So yes, remdesivir is one of many drugs that are being used to treat COVID, but it is no way a magic bullet. And its utility and efficacy is still being truly evaluated. There are some studies that suggest that it has a beneficial effect without any harm, and that's why it's being used. But there are other studies that question its true utility, and there are very narrow indications for it as well.
What do we tell our families in India who hear about these large cocktails of medicine that they can take preventively? There's a lot of information, perhaps misinformation out there that people are being told. This is being shared. Some of it may be right, some of it probably isn't. I don't know. So how do we help people kind of work their way through this?
Not losing sight of the real preventative strategy. It's so interesting. We went over what you need to do. You don't need to take multivitamins or zinc if you're wearing a mask and you're keeping your distance and you're washing your hands. But if you want to, in the normal doses, I don't see any problem with sort of these over-the-counter things that are routinely used. And I'm just talking about like zinc and multivitamins. But the fact of the matter is, if you're so concerned I'm not saying you, Lalita, but I'm just saying in general, the collective, if you're so concerned, adhere to those other strategies because they worked. And I'll tell you, up until when I was vaccinated in December, that would be a 9-month period where, I certainly was coming in contact with people who were COVID. I was only doing those things: masking, washing my hands, and trying my best to keep my distance. Although I'm sure I came in contact with a lot of people that were COVID positive, and yet, knocking on wood, I didn't get it. And so I got to believe that if you adhere to those strategies, you're going to really, really reduce your risk.
Yeah.
And if you want to take an over-the-counter supplement like a vitamin or zinc, it's fine, but don't do that in the absence of those other strategies.
Right. Okay. Yes. Additional, but not instead of. Let's see, we're kind of getting towards the top of the hour. I'm going to weave some more questions together. Yeah, this is an interesting one, and a few people have asked this. We're only talking about COVID now. So what are the metrics, especially in a situation in India where we are right now? We certainly have been there here too, where people don't want to go to the hospital, even if they have other things happening with them. So how do people make these decisions as to when they should go and look for care and when they should perhaps it's safer to stay home?
It's a really tough question because, it takes years to become a doctor, and
Right.
those are decisions that medical professionals generally should make rather than putting the onus on individuals.
Of course.
So I would say, from the safety of your home, use a phone, use a telemedicine platform. There are other ways of trying to get care in a safe manner, or get more information to make that decision. And I think reaching out to medical professionals, I know here in the US, telemedicine has been fantastic in that regard, and in being able to still connect with our patients, talk to them in a safe manner. They're not at risk for getting COVID because they're at home. We're not either because they're at home, and yet we can direct them to the proper care, whether they need to go to the hospital or a clinic, or whether it's something that can be managed at home and followed up. So I think that would be my advice: is seek the advice of a medical professional, try and use these other strategies, telemedicine, phone calls, other ways of getting the information, but don't ignore it just because there's COVID in the hospitals.
Health is really quite astounding. I think I've seen my doctor 3 times in the past year on telehealth, and now I wonder why I ever went in. Like, you can do quite a lot with, if you have access to video and everything, you can do quite a lot over the internet as well. So that's definitely a great recommendation. As we're wrapping up, I think I want to look a little bit towards the future. So people are asking about whether we're going to just be vaccinated all the time, whether these new variants are going to become stronger and stronger, so the vaccines are going to be perennially out of date. And so then also, are we going to really be in lockdown forever? Like, is this our life now?
Yeah, I wish I could say that definitively. I would be just guessing, but most likely we're still learning about these vaccines. There are some vaccines where you get immunity for an extended period of time, years, and sometimes life. There are some vaccines, like the influenza vaccine, that you have to get on a regular basis. And part of that has to do with the virus changing. Part of it has to do with your immunity waning over time. And those are the questions I think that we need to have answered, and that will be answered in the upcoming year. I know they're studying the vaccines and how they impact individuals, which is, when does your immunity wane, or does it stay strong? And also, is it still effective against all of the types of vaccine, or all the variants that are out there? Is your immunity effective against the kinds of viruses that are circulating out there at that time? And nobody can answer that question yet, but I think we will learn that over time. And when we first got vaccinated, I was hoping for a 3 months of immunity, and at best, and keeping my fingers crossed that it would be longer. It's now been 6 months, and the studies have shown that our immune response is still strong at 6 months, and that's a really encouraging sign. So we just have to wait and see, and hope for the best. It may be that we are getting boosters in the future, and that wouldn't be such a terrible thing, because it could then be tailored to what's out there and keep us safe.
Right. And so in the meantime, we just stay masked up. We continue to do all the things. So you say you agreed with the CDC guidelines that we can be unmasked outside. My concern with that is that people they kind of adjust rules to that. They then bring their own opinions into the rules. So when the CDC says it's okay to mask outside, people might think, well, then surely, inside with just a couple of people should also be fine. And then before we know it. So how strict should we be with ourselves as these new variants keep coming up?
Yeah, if you're outside and to get the virus from someone else, you have to be in close contact for an extended period. It's not going to happen from stopping for 30 seconds and saying, "Hi, how are you doing? I'm doing great," and then continuing your walk. It's just not enough time to get it. And if you're out walking or running or cycling in the open, again, you're diluting the virus in all of the air that's out there, as opposed to an indoor environment where it's the same air that's circulating and the concentrations are getting higher and higher. So, but let's contrast that with a situation where somebody has COVID, you're at a picnic and you're all sitting at a picnic table very close to each other, and that person is giggling and laughing and talking loudly, and there's no wind. And so it becomes more like an indoor environment because you're just staying in one place, you're not moving, and you're sharing the air in that area with someone else. That's outside, but for me, that would be a higher risk scenario. And so I might elect to put my mask on if it was going to be something like that. So every situation, it's just using common sense, I think.
Yeah. Okay. I'm going to end with a question that I think is going to be relatively straightforward. So we end on something a little bit simpler because you've addressed very many complex questions. I just want to acknowledge there's some questions and some among the many, many expressions of thanks in the chat. There's some expressions that we'd like to talk a little bit more about the government's role, about policy. And to those of you who are asking these questions, I appreciate the questions. Dr. Mahadevan is a medical doctor, and we invited him today to speak in that role. We will, either we as the Center for South Asia or other entities at the Stanford campus, we will have webinars and lectures like this, Q&A sessions around these questions. So we're not ignoring them, but we don't feel that it's entirely appropriate to be asking Dr. Mahadevan, who found an hour with very short notice to come and talk to us. So we're really focusing on the medical side of things, but that doesn't mean that these other questions are not entirely valid, and they will be addressed in other platforms, in other settings. Okay, thank you all for coming. I'm going to end with this question because I know this is a very common concern. What do you do when you are already immunocompromised? Do you take the vaccine or do you not?
Yes, absolutely. You take the vaccine. It's even more reason to take the vaccine. Absolutely.
Okay. All right. Okay, good. Well, then that answers that question very clear. I'm pleased about that. So I want to thank you for joining us today. As I said, at short notice, you were able to find time. And it was unfortunate that you were in India when all this happened, but I guess it was fortunate for us and that you were able to come and talk to us and really express what you saw on the ground. And I want to thank all our audience members for being here. We had a really fantastic group of people, and I'm so grateful for all your questions. southasia.stanford.edu is where you can find out about all our events. You can also sign up for the mailing list, so you'll be kept in touch. We're on Twitter, we're on Instagram, we're on Facebook, so you can follow us. And please join me. We can't hear you, but please join me in thanking Professor Mahadevan for joining us today. Thank you.
Thank you. It's a pleasure. And thank you to you and Jisha and the Center for South Asia for having me. I really appreciate it.
Thank you.